in chapter 8. We just broke into chapter 8, and we were kind of reviewing a little bit what we're going to have on the lab test today, or tomorrow, in this case. Almost scared you, didn't it? As far as we'd left off on the frontal lobe, be dealing with language and personality and some memory. That was a heck of a sneeze, wasn't it? The temporal lobe, we know, deals with hearing, and occipital lobe deals with vision, and the parietal lobe deals with somatostatic, somatosensory responses. So that's kind of where we had left off the other day. And I think we had made the statement that Aristotle at one time thought the purpose of the brain was to cool the body. We did talk about that.
Yes.
And then we ended with Sir Charles Sherrington, didn't we? Where he thought the brain, or he called the brain the great ravelled knot, in which he said we'd never totally understand the brain because we're trying to understand the brain with a brain in which we don't understand. So that brings us up to date after taking Friday off. That's probably too much for all of us, but go into neutral when we do that. I know I do. 208 has a table 8.1 that sums up the lobes for you again. And they have another lobe listed, which is a deep within lobe that for us to identify that on a sheet brain, not going to happen, probably. From there, we want to look at visualizing the brain on 209. Different ways to visualize the brain. Technology has expanded such a large amount. We've gone from CT scans to PET scans, positron emission tomography, to magnetic resonance imaging, MRI, to functional magnetic resonance imaging. You know, that bothers me a little that we paid for MRIs for years and we're just now getting one that's functional. Why would they? I don't understand that. Why do you come up with a name like that on one? Probably of all these, I mean, most of these, and y'all may even be familiar with most of these, but the PET scan has got to be my favorite out of it. It goes something like this. There was a guy that his dog got run over. Of course, dog is man's best friend, and it upset him tremendously. So he took his dog and rushed to the vet, and the vet had people waiting in there, but this guy rushed right through the whole lobby and right into the back and demanded that he see the vet right now. His dog got run over. So a big commotion and everything, the vet came up there, what's going on? And he knew the fella, and he said, my dog got run over. The doc, you gotta fix my dog. And so he examines the dog and says, sir, your dog's dead. There's not anything, I can't bring him back to life. He said, I want a second opinion. So the vet goes in the back and he brings back this cat and throws this cat on this dead dog sitting there. And the cat, boy, he sharpens his claws on him, and boy, he's strutting his stuff, and the dog doesn't even flinch. And he picks the cat up and headed back, and he said, even my cat says your dog's dead. If a dog don't respond to that, they're dead. He said, I want another opinion. So he comes back and brings this big old Labrador retriever. And he sniffs around this table that the dead dog's on, and he jumps up on the edge of it, sniffs around, and barks a couple times at the vet. Vet says, see, even my Labrador retriever says your dog is dead. By this time, the guy's beginning to realize his dog may be dead. So he gathered his dead dog up and started heading out, and he asked the vet, he apologized for causing such a ruckus, and asked the vet, what do I owe you for your time? He said, typically you bring a run over dog in, and I wouldn't charge you anything, but after you required the lab test and the CAT scan, it's going to be $249.
Oh my God.
So that's as bad as a PET scan gets right there, isn't it? Well, we'll move on. That didn't go good on one.
That's very bad.
It's a PET scan.
It's a bad.
Oh, is that bad? I'm sorry. That's as good as mine gets. On page 210, we'll look at the electroencephalogram, the EEG. Deviations from normal EEG patterns can be used clinically to diagnose epilepsy and other abnormal states. And the absence of an EEG can signify brain death. Imagine that. We hook you up and we can't get any kind of signal from you, you may be brain dead. And I have tried for a long time to write a grant to get one of these, because I'd love to hook some of y'all up and just see what we get. But I've yet to find one within an average college budget, if you know what I'm talking about. But maybe one of these days.
$500?
500, yeah, they're $5.99, and that's a. Then there's different waves they look at. Alpha waves are best recorded from the parietal and occipital regions while a person's awake and relaxed but with eyes closed. These waves are rhythmic oscillations of 10 to 12 cycles per second. The alpha rhythm of a child under the age of 8 occurs at slightly lower frequencies of 4 to 7. Beta waves are strongest from the frontal lobes, especially the area near the precentral gyrus, because they respond to stimuli from receptors and are superimposed on the continuous activity patterns. These constitute evoked activity, so they'd have to be somewhat awake and to get a response. Theta waves typically are found in newborn infants and in sleeping adults. The recording of theta waves in an awake adult generally indicates severe emotional stress and a forewarning of a nervous breakdown. See, that's the one I want to find for you to help you out before it's too late. But don't you find it funny that here's waves that we'd find in a newborn infant and a sleeping adult? So while we're sleeping, we're just big old babies, aren't we? That's what it's saying. Delta waves. Just the last sentence sums delta waves up. If we find that in awake adults, you've got some brain damage going on. And I'd love to check those two out right there. That may explain test scores. It could. Then we get into sleep. Anybody studied sleep? You had psychology? Well, did they study some sleep in psychology? It's been so long, and that's about the only sleep studies that we looked at, even in going through school and science classes. Seldom did we know much about sleep. And we're learning more and more about sleep, because now we're diagnosing sleep apnea as a serious health problem. And 20 years ago, you couldn't get insurance to pay for anything to help for sleep apnea. Sleep apnea was a joke. But Uncle Kenny was one of the first ones that fought that battle and won that battle. When the doctor finally wrote the insurance company and told them, this man will die if you don't do something, that woke him up a little bit. And he had serious sleep apnea. Well, boy, it made a difference.
He had a machine at night.
He had a machine, and those machines are more common, more prevalent, and it's something you have to get used to. And
A BiPAP or something?
CPAP. Yeah, I thought for years my dad had sleep apnea, and he was going through some health issues, nothing major, but something that needed to be checked out. And me knowing the doctor, being a former student of mine, he talked to me every now and then about my father. And I'd pick his brain, and we was going through, he's mentioned different tests he's going to run, and I said, before you're done, run him through a sleep study. And he said, yeah, that does fit a lot of the symptoms. And put him through the sleep study, and my dad's one of those, when he comes in, if he sits down 5 minutes, he's out. You know? So he comes in, he eats supper, he sleeps till 10 o'clock. Of course, he's got a particular show on. If mom switches the channel, it wakes him up. You know, it's just a comment. But he wakes up at 10 o'clock and then goes to bed, sleeps some more, and gets up at 5 o'clock before the chickens do, and wonder why I can't do that. But needless to say, they put him in the sleep study, and he went to bed early that night because there wasn't anything else to do. He's watching a ball game on TV, I think, fell asleep pretty quick, and he woke up, I don't know, 10:30 or 11 o'clock, and he'd been asleep maybe a couple hours, and to go to the restroom, so they had to come in. He's got wires hanging all over in those sleep studies, so they had to come in and help him get to the restroom. And when they put him back in bed, they said, Mr. Dwann, we're going to go ahead and put a CPAP machine on you and make adjustments because you've already qualified. Typically, it takes all night to qualify. So when it reaches that point, health issues just start doubling. I mean, you'll end up with kidney problems and high blood pressure problems and heart problems, and it all is linked so dramatically. And what's really linked to all this is that your wife or slash husband, there's females with this as well, they have a hard time sleeping when snoring goes a lot with this. And and even with a CPAP machine, those things as quiet as they are today. Now his Uncle Kenny's was not quiet. It was like firing up a generator. He slept through it all night, but Aunt Priscilla got used to it. But the new ones are fairly quiet. I mean, they're really quiet. But somebody's struggling with that, and that machine keeps forcing air down you, where you technically quit breathing. Some of them quit breathing 40, 50 times a night. And their body works hard to bring the oxygen back, so when it does that, when you wake up the next morning, your body's worked so hard all night, you're more tired than you was when you went to bed. And so you want to take naps all day, you're draggy, it starts pulling your other organs down. And so it's quite an issue, and it is recognized today, and we're still learning more about sleep than ever before. And in making adjustments to the CPAP machine's important, so it's giving you the right quantity of air, not too much. We don't just blow you up like a balloon, just forcing air down you all night. But you got to get used to wearing a mask. And, I mean, there's elastic strapped around your head, and you got a mask and a hose, and you got to get used to it. But if you don't, I mean, it makes an amazing difference in your life if you don't. And I know people that, I can't wear that, and they just quit. I don't think they'll live very long, because I think they'll start having serious health problems. And I think to an extent, by the time Uncle Kenny got it diagnosed, because it was a new diagnosis, and got treatment, I think he already had some serious damage going on.
The lack of oxygen in the heart does
Major difference, major, yep. But here they're looking at rapid eye movement, or REM sleep. Now, what is REM sleep? You guys have had psychology help me out here. I'm not a sleep expert by any means, but I do know we need it. That's important.
Isn't it the moment in your sleep where you're at your deepest sleep?
I don't think it is our deepest sleep, actually.
Or is it right
It's like
It's your lightest sleep.
one of several stages that you'll start here and pass through these stages, and then you'll come back through these stages. And the faster you can get to your deepest stage, the longer period of time you're gonna get better sleep, better rest. But have you ever stayed in that I call REM sleep, but I guess it's the sleep in which you're dreaming all night, and you wake up just exhausted the next morning because you'd been running from somebody and fighting battles, and I mean, it just turned into a nightmare, and you remember pieces and parts, and none of it made any sense. You could see faces and names, and it's the craziest night you ever had. What causes that? I have no idea. But I do know it doesn't take me long to get into the last stage. By the time my head hits the pillow, I remember nothing from here to here, from supine to prone, or however, I remember nothing. And in fact, I was tested several years ago for sleep apnea and did not qualify, although my wife disagreed because of a bad snore. A year ago, this past December, the doctor sent me back to a sleep study, and the guy come in and he hooks me up on this machine. He said, now lay there for a minute. I've got to go calibrate the computer. So I'm going to be talking through the speaker here, and I'll ask you questions, and I want you to move a leg or move I want to get things calibrated here. Before he got back to the office, I was out. He couldn't calibrate anything. Now, that's how fast it took me to go to sleep. So he said, I think you qualified, Mr. Dwann. So I do have a CPAP machine today. I guess like father, like son. Finally caught up with me. But rapid eye movement, REM sleep, the name describes characteristics of eye movements that occur during the stage of sleep. Now, if you've never actually know when you do this, if you ever watch a baby sleep, you watch your baby sleep, and boy, they may be stills, they can be, and their eyes are just going nuts underneath the eyelids. That's got to be rapid eye movement. What do you think? And then when they start dreaming and they start giggling and everything, it cracks you up, man. You can sit there and hear them talking to themselves. I mean, the kids are crazy. But non-REM sleep, or this is resting sleep. Your brain's not busy. It's actually hit a relaxed point. And those guys at the sleep study place told me there was like 8 different stages in which you fall through and come back through. And how long it takes you to get there and how long you stay in there, a lot of that determines whether you qualify or not. And of course, they're counting the number of times you actually quit breathing. And I don't remember what they told me. I'd like died 25 times in an hour, and most of those quit breathing for more than 15 to 20 seconds each. And lack of oxygen just not going to do any tissues any good. I mean, that's where it's going to get you. When people first fall asleep, they enter a non-REM sleep of 4 different stages and then ascend back through these stages to REM sleep. Let me ask you, anybody in here can take what's called a power nap? Does a power nap work for anybody in here? Now, I know some people, they say, if I take a nap, I'm out and I can't get back up. And a power nap does me wonders. I don't know why that is, but 15 or 20 minutes and it rejuvenates me pretty good. But my wife she does not do power naps. If she passes out, she'll be out for 2 hours. But most times she's not passed out. I'm the one passed out. But it's just different people's different on power naps. I'm not sure why that is. So you start in a pretty good stage and you go through several stages and you come back to REM. It says the limbic system is activated during REM sleep. The limbic system is involved in emotions, and part of it, the amygdala, helps to mediate fear and anxiety because these are common emotions during dreaming. It makes sense that the limbic system would be active during REM sleep. And it's amazing some of the things. You ever had one of those dreams, you don't know where it came from, you have no idea, and then you're driving down the road one day, think, I've seen this before, but you know for a fact you've never been there. Is that a deja vu dream? Okay, I'm glad I'm not the only crazy person in here, so other people have those as well. Well, there's a lot to be said about dreaming and sleep and the components of sleep, but the latest data says we need as much sleep as a child, adults do. And that relaxed state, I think, relieves stress off the entire system. And if you don't get good sleep, some people have difficulty sleeping, that is even more stressful upon the body. So at one time where we could get by with 6 or 7 hours of sleep, they're still saying we need 8 hours of sleep, just like kids do. Some kids even need more than that. But some people are different. Some of y'all can get by on 5 or 6 hours and you feel fine. Anybody in here like that? Yeah, I think it's a learned behavior with 2 little boys, right?
I don't know. If I sleep more than 7 hours, I feel exhausted.
It tears you up on the other end of it. But some people, they just gotta have their sleep or their, as my wife would say, after 9 o'clock at night, she turns into a pumpkin. Whatever that means, she's pretty much toast after 9 o'clock. A lot of times we don't get in bed till after that, but basal nuclei, this is what we need to know about basal nuclei. On the next page, it says its function is in the control of voluntary movements. The basal nuclei is control of voluntary movements. Then we get into the next topic of cerebral lateralization. Well, cerebral lateralization is where the right side of the brain is controlling the left side of the body and the left side of the brain is controlling the right side of the body. We know this decusitates at the base of the brain, where if somebody had a stroke in the right side of the brain, which side of the body would be paralyzed? The left, the opposite side. So they used to use the terminology that somebody was right-brained or left-brained, and they try not to use that terminology anymore, so they use lateralization as a different term they throw in there now. But we do know that the corpus callosum plays the role in allowing the 2 halves of the brain to communicate. And we know for our test this week in lab that that's where information crosses over. And they talk about the split brain procedure in here that they used to do on epileptic patients. And it did stop, or a lot of times at least slow down epilepsy that were extreme cases. But then when they got into small cerebral spatial tasks where left and right hand had to coordinate to get something done, it wouldn't. Now, overall in general life, you didn't tell a lot of difference in these people. But when they got down to these tiny tasks in some cases, they couldn't do them because the left and right side would not communicate. And I do know that children born without a corpus callosum typically doesn't live very long. At least when they did the split brain procedure, these people lived long enough that the brains had mapped in what they're supposed to do, the right and left hemisphere. So there's a ton of studies they've done on this as well, and they say that specially designed experiments in which each hemisphere is separately presented with sensory images and the patient is asked to perform tasks, it's been learned that each hemisphere is good at certain categories of tasks and poor at others. And we know that. We're going to get into some of that as we go. Which hemisphere do you think is best for language, right or left? It is the left. Similar experiments have shown the left hemisphere is generally the one most for language and analytical. So if you're right-handed and left hemisphere dominant, you're mathematically inclined. Would you agree with that?
What?
You're good at math. Yes?
I am.
Everybody in here right-handed? Well, all right-handers?
I disagree with that.
You disagree? Cerebral dominance. Now, this is a term that they really don't like for some reason. It's analogous to right-handed or left-handed. If you're right-handed, you'd be left cerebral dominant. If you're left-handed, you'd be right cerebral dominant for most of the cases. And people generally have greater motor competence with one hand or the other. Now, true ambidextry is actually hard to find. You can train the other hand to do what the other hand does. It may not do it as well. For instance, if you broke your right arm and you can't move it and it's sitting right here, how are you going to eat if you're right-handed?
I can't.
You can't? You
I
can't
can't.
train your left?
No.
What do? Stick it up your nose and in your ear?
Just use my right hand.
I don't know if you, let's say we tied it behind your back, then what are you gonna do? Just stick a plate in front of you and lap it up like a...
Make somebody else help me.
Well, believe it or not, against your unpopular belief here, that you can train the other hand to do what the hand that you normally use can do. It's just typically not as good. Now, if a person lost that hand, they're gonna have to do something at some point. But you can train. The term cerebral lateralization or specialization of function in one hemisphere or the other is thus now preferred to the term cerebral dominance. So instead of cerebral dominance, they want you to say cerebral lateralization. I see no significance in either term. It's just something they've turned to. Experiments have shown that the right hemisphere does have limited verbal ability. You know, here, this is a speech pathologist. A speech pathologist identifies the problem, whether it be a stroke or a traumatic brain injury or just something that the kid's born with that we can work through, but then they turn and find a part of the brain and teach another part of the brain to do that skill. That's what speech pathology does. And if this part of the brain is damaged or does not function very well, and sometimes it's just simply on a small child that just has some speech impediment, it's just training that part of the brain to do it right. But in traumatic brain injury or stroke victims, when you get into those situations, they literally find different parts of the brain to train for them to communicate. Will they communicate as well as they used to? Probably not. But can we get them back to communicating? Yes, you can. And that's what they're talking about here. So right hemisphere does have limited verbal ability. More noteworthy is the observation that the right hemisphere is more adept for visual spatial tasks. The right hemisphere, for example, can recognize faces better than the left, but it cannot describe facial appearances as well as the left. In split-brain patients, it has been found that the right hemisphere, acting through its control of the left hand, is better than the left, controlling the right hand at arranging blocks and drawing cubes. So what they saw was some artistic ability in right hemisphere people, left-handed people.
I agree.
So some artistic ability. Patients with damage to the right hemispheres might be predicted with split brain research have difficulty finding their way around the house and reading maps. So that's more of a left brain activity. So musicians tend to be left-handed. Artists tends to be left-handed. Now, does that mean a right-handed person can't play music? Absolutely not. You can learn music, just like I said, you can train. Now, I went to a concert one time, first time I'd read this, and I'd gone to a concert, and after the concert, I just paid attention watching them sign autographs. And there was 9 people in this band. There was 8 band members and the band manager, who had really, he shouldn't have been anywhere on the stage. He had no musical talent whatsoever. He'd get up there and make announcements and stuff and sit back there and shake a rattle off beat. So it's like, get off the stage, man, manage the money, get off the stage. But he signed right-handed, the other 8 signed left-handed. So who were you musicians? Yeah, who was your money manager? Yeah, that was the right-handed guy that can't sign, that can't play a lick of music. But it's amazing. And those guys, although when they signed left-handed, you couldn't read half what they signed. It wasn't uncommon for them to pick up a right-handed instrument though and take off with it. Because my brother-in-law plays bass guitar for New Song and has for years, making a living at it, making way more money than I'll ever make doing this. And he works half the year. He never learned how to play guitar left-handed. He's as left-handed as it comes. When he decided he wanted to mess with music, his parents were like, yeah, we're not gonna throw away $500 on a guitar here. So they go down to the pawn shop and find a guitar. Well, the only thing they had was a right-handed guitar. Knowing him, he'd probably flip it upside down, play it backwards now. But they buy him this guitar, so he learned to play right-handed, sitting on the bed listening to radio. He is all but ear. Now that's right brain, left-handed, without a doubt. And if you ever visit with him, say, there's something strange about that guy. Of course, he has a brother-in-law, you know how that goes. But it definitely, he's every bit of a left-handed musician. Here they tell you some more. Perhaps as a result, the role of right hemisphere in comprehension of patterns and part-whole relationships is the ability to compose music, but not to critically understand it. It appears to depend on the right hemisphere. Interestingly, damage to the left hemisphere may cause severe speech problems while leaving the ability to sing unaffected. So speech is left side, putting harmony to it comes out of the right side. The lateralization of functions just described, with the left hemisphere specializations for language and analytical ability, and the right hemisphere specialized for visual spatial ability, is true for 97% of all people. It is true for all right-handers, who account for 90% of all people, and for 70% of all left-handers. The remaining left-handers are divided about equally into those who have language analytical ability in the right hemisphere and those whom this ability is present in both hemispheres. Do you know a left-handed accountant? Now that would be an odd duck on the other side. I do know left-handed accountants. So they're left-handed, yet they're left brain dominant, so that it kind of fits the odd situation here. Do you know anybody that can't speak without stuttering, but they've made a living singing? This is, see, every year it's getting harder to come up with this name. Jed may remember this name. Mel Tillis. Heard of him?
Yeah.
Of course, his daughter kind of took over his, and I don't know where she's at now, but pretty good singer herself, but she could talk without stuttering. But he actually made some movies, and they were kind of comical country and western type movies. And to say his part, he'd have to do some kind of music or ring a bell or something to get his part out, and it made the movie even more comical. But he could sing, yet he couldn't talk to you in a straight sentence without stuttering halfway through it and all the way through it in most cases. So there's the classic case of what this is explaining right there. So it's interesting to speculate that creative ability of a person may be related to interactions and information between left and right hemisphere. And what they've done here is they've gone into a college in this last paragraph, and they researched the art majors, and they found that by far the majority of the art majors in this university were left-handed. And they found that Michelangelo and Leonardo da Vinci and those big-time art people that made millions, they're left-handed. So does that mean a right-handed person can't do art? No. I don't know if they'll be good at it or not, but you can still do art. I've seen them throw stuff on a canvas and call it art. So oh man, that's the most beautiful thing. Really, anybody could have done that. I didn't see anything, but I'm right-brained, or I'm left-brained and right-handed, so I'm not seeing the artistic that the artists are seeing there. So, well, language, the next category, they give us about a full page here. about a full page on language, and you could take an entire course over this, okay? And in fact, they may have it busted up in 2 courses now. I know they used to call the course aphasias, and it has a ton of science in it because it's all brain. You're learning pieces and parts of the brain that deal with language, where it starts, where it develops, where it's spoken. It's crazy. But speech pathologists would take a course that would understand this. You're just going to get the tip of the iceberg here today. So knowledge of the brain regions involved in language has been gained primarily by the study of aphasias, speech and language disorders. Now that ranges from inherited disorders to car accident, traumatic brain injuries, to stroke victims, that any type of language disorder, this has been studied. In most people, language areas of the brain are primarily located in the left hemisphere of the cerebral cortex, just like we originally talked about. So there's 2 major areas in the left hemisphere of the cerebral cortex that we're identifying here to start with. And this Broca's area, and it looks like it's spelled Wernicke's area, but it's actually pronounced German-like. It's Wernicke's area, okay? So Broca's aphasia is a result of damage to the Broca's area located in the left inferior frontal gyrus. Okay, we're on the left side of the brain. We're underneath the frontal area, and gyrus is a raised portion, correct? I mean, we can identify that just what we already learned. Common symptoms include weakness of the right arm and right side of the face. People with Broca's aphasia are reluctant to speak. Here's your test question. They're reluctant to speak, and when they try, their speech is slow and poorly articulated. If you're not good at something, you don't want to do it, do you? And that's exactly the case here. This is the part of the brain that speaks the sentence. Their comprehension of speech is unimpaired. They understand what you're saying, but they cannot repeat that sentence back to you. People with this aphasia can understand a sentence but have difficulty repeating it. It should be noted that this is not simply due to a problem in motor control, because the neural control of the musculature of the tongue, lips, pharynx, and larynx are left unaffected. So this is a brain problem, brain damage problem. And then the Wernicke's area. This results in speech that's rapid and fluid. People with Wernicke's damage, they can speak a blue streak. It may not make a hill of beans of sense. It's like the guy on the sidelines on Waterboy. You know, he's got one eye looking one way and the other eye, and we're out in the middle of the movie cruising along, and you hear this guy say something. What did he just say? I swear he's got Wernicke's damage. And what they call it, a word salad. They may not even be real words he's throwing out there. It's just something his brain has catastrophically put together to throw out there. And a person with a real brain doesn't comprehend that. So what did you just say? And so they like to speak, but they can't organize a sentence to speak it to save their life. So, and they don't understand a whole lot what you're saying to them either. So they tell you that people with Wernicke's aphasia produce speech that has been described as a word salad. The words used may be real words that are chaotically mixed together, or they may be made up words. Language comprehension is destroyed. You speak a normal sentence to them and they're thinking, what did you just say? They speak back to you and you think, what did they just say? Well, we got some serious communication problems going on with this guy. So, made up words. Language comprehension is destroyed. People with Wernicke's aphasia cannot understand either spoken or written language. So this tends to be, the Wernicke's area is where a sentence is organized. And they're not organized. So we get it organized here. Broca speaks it. See what I'm saying? So the concept of the words originates in Wernicke's area. Information coming in from the visual cortex must project to the Wernicke's area. Similarly, in order unspoken words, the auditory cortex must send information. So we have information coming in from several places to the Wernicke's area. The Wernicke's area organizes it, Broca's area speaks it. See? Now, to speak intelligibly, the concept of words originating in Wernicke's area must be communicated to the Broca's area through what's called a fiber tract called the arcuate fasciculus. And if for some reason it is damaged, then you have a conduction aphasia. So the sentence is organized, and we can't get it to the Broca's area to be spoken properly. We're not conducting it from here to here, so it's a conduction aphasia. The angular gyrus is believed to be a center for integration of auditory, visual, and synesthetic information. So this is like, it's where all the terminology comes in. It all comes here. It goes to the Wernicke's. Wernicke's organizes it, shoots it through the arcuate fasciculus to the Broca's where it's spoken properly. Can you see how many places there could be damage to mess up a speech there? If the words aren't getting here, we have nothing to start with, do we? So we could have an aphasia, a gyral aphasia at the angular gyrus. So damage to the angular gyrus produces aphasias, which suggests that this area projects to the Wernicke's area. Some patients with damage to the left angular gyrus can speak and understand spoken language, but cannot read or write. So there's even, now, do you think speech pathology would be an easy field? It's not. It's actually a very specialized field that you'll go to school a little longer than the average person. You'll get out with a minimum of a master's degree. You have to continue to take so many clinical hours of, it's kind of like a doctor. You got to go back and keep up with what's going on. But they are nationally certified teachers by the time you pass all the tests to make you eligible to do something. You can teach in a public school, or you can work in a hospital setting. Right now, speech pathologists in this area is making upwards of $70 to $90 an hour. And there's a shortage. You can go anywhere nearly, and because they're making 70 to 90, tells you there is a shortage and you can almost name your price. Public schools, it's a requirement. They gotta have one. What else are you gonna do except pay them their price? And most of the public schools used to have a speech pathologist hired on as a teacher, and they got by with a regular teaching salary. And I think being a special educator, they got 5% above base, which wasn't much. And now, these people are going to the private sector, and they're contracting back into the public schools and naming their price. So there's jobs. There was over 200 jobs in the state of Oklahoma at one time, just in the state of Oklahoma. You can go anywhere in the United States, land in that city, and you'll find a job as a speech pathologist. Yeah. And again, like all other things, the paperwork overcomes the actual, it's just overwhelming, the paperwork you have to do. But the jobs are there. So it's something to think about. We don't run into many speech pathologists. All right, moving on to limbic system and emotion. Starting on 216. The limbic system is your basic emotional component of the brain. This is very instinctive. And it's so basic, instinct that it is the one that tells you to eat, sleep, drink, reproduce, continue the species, and then go through the process again. That's how instinctive it is. And it's so instinctive and so built in and so innate that you have very little conscious control over any of this. Now, it's as, everybody, you've heard this saying, everybody's wired a little different. And you have to agree with that to an extent. Does anybody in here get car sick? What about if you're driving?
Yeah, I think that's okay.
It doesn't matter. You just get car sick. So
Depends.
now,
Not usually, but occasionally.
it's not a choice of yours to take off on a trip. Say, I'm gonna get car sick 3 times on this trip. I mean, if it's your choice, you're gonna choose not to because it's just disgusting. It's not something you want to do. But if we had conscious control, that's a limbic system response. If we had conscious control, we could overcome that. But we don't. You know anybody that cries at the drop of a hat? Jed, don't mention your wife, it'll get you in trouble.
I've never seen her cry.
She's tougher than most of us.
She is.
You ask them why they're crying, and they, I don't know why I'm crying. It's a limbic system response, and you know, hormonally controlled to an extent, but limbic system response. And a lot of these things are. Well, they've studied the limbic system a lot, and they studied the hypothalamus a lot. And the next several sections here is going to be mentioning both of those. Although they're separate entities, they work together on a lot of things. Now here they're going to tell you they're separate entities. Later, in, I think latter part of chapter 9, they'll tell you that they're together. The hypothalamus is part of the limbic system, but it's not. Okay, the hypothalamus is not part of the limbic system. Here they tell you it's the neural basis of emotional states are the hypothalamus and the limbic system. They do work together. The limbic system, here's your components: the cingulate gyrus, the amyloidoid nucleus, the hippocampus, and septal nuclei. The hippocampus deals with long-term memory, and here it is, an instinctive capability. The limbic system in humans is a center for basic emotional drives. There is few synaptic connections between the cerebral cortex and the structures of the limbic system, which perhaps helps explain why we have so little conscious control over our emotions. There's a closed circuit of information flow between the limbic system and thalamus and hypothalamus called the Pepez circuit. They communicate. That circuit just is within those three things, and they communicate. But we have very little conscious control when it comes to the limbic system. And like I said, everybody's wired a little bit different. If I see human blood, I'm liable to pass out. But I can mess with animals all day long. I can lance abscesses. It doesn't matter with animals. I just whatever. But you know, Nick one time decided he wanted to run his head into a flagpole. I wonder about the boy sometimes. As far as I know, there was not significant brain damage, but he had a pretty good rip in his head there, so we got him into the doctor's late one day, and the nurse had already went home, and I knew the doctor, so he said, well, help me stitch him up. No problem. So I went in there, we visited the whole time, we got him stitched up, we cleaned him up, got him stitched up. When I went to leave the doctor's office, I turned around and looked at the doctor, and I said, where's your nearest couch? He said, right back there. I barely made it to the couch before I passed out on it. I could feel it coming on at that point. When I was a little kid, I got kicked in the lip on the playground. Well, I had like 3 or 4 stitches put in it. Made it through it just fine. I was following my granny down the sidewalk. My mom brought me to Granny. Granny took me to the doctor, and I was going to the beauty shop with Granny. That was exciting. I'm walking down the sidewalk, Main Street, Podon. I just passed out on the sidewalk. Granny thought I died. Why, I don't know. But those are limbic system responses that as I become older, I feel them coming on, so I go sit down so I don't crack my head on the sidewalk. But it's crazy. If I had my wishes, I probably wouldn't be teaching, but I think I could be in a medical field, but I can't go in there and let's do surgery on these intestines and open up and whoop, fall right in. That's not going to be kosher, is it? So I think they'd have kicked me out of med school after I passed out 2 or 3 times. So I had to make a different decision. I'll just tell y'all about it instead. Well, that leads us into the studies they did. And so mark page 216, the surgical removal or ablation studies that they did, and found we studied aggression, fear, feeding, sex, and goal-directed behavior in animals. And we'll associate this to both the limbic system and the hypothalamus. So we'll start there on Wednesday. Oh,